Yeah, you can change the age forward, but forward age change causes increase in atherosclerosis. It does not decrease atherosclerosis. So age is a factor that you can't control. How about gender? Men have more atherosclerosis incidents as compared to premenopausal women. Can you change that? No, you can't. Although post-menopausal women and the men have equal probability, which leads to some people, some doctors and some pathologists to think it may be estrogen. But what is interesting is that administering estrogen after the menopause actually increases the risk of atherosclerosis. So if it was estrogen before menopause, and that is something that was responsible for reducing the atherosclerosis, then it is a strange thing that after the menopause, when the estrogen is administered, it increases atherosclerosis. So clearly that may not be the reason. So there is something in the premenopausal women that protects them from atherosclerosis. So that cannot be changed. Although nowadays there are many kinds of surgeries, and one man can become a woman and a woman can become a man. Again, these are hormones and surgical therapies, but the genetic makeup somehow favors females to not have, or to have lesser incidence of atherosclerosis. Then genetics. So genetics, there are hereditary propensities of people to have atherosclerosis or not, or to have more risk of atherosclerosis or less. And that can be two types. One is where there is a cluster of other risk factors that are present in a person's family and are going to affect that person as well. For example, what do you think? What do you think? For example, diabetes mellitus, hypertension, and cholesterol. There are people who have their parents and their grandparents who had hypercholesterolemias, or who had increased cholesterol and had diabetes mellitus and had hypertension. Such folks have a clustering of the factors that is going to affect them as well. So that is one way genetics can cause problem. The other way is that there are some genetic hereditary problems, for example, familial hypercholesterolemia, where a homozygous patient of familial hypercholesterolemia usually starts encountering myocardial infarction by the age of 20. By the age of 20, the patient starts experiencing MI if he is homozygous for familial hypercholesterolemia. So what is the problem? The patient has hypercholesterolemia, increased cholesterol level. So just higher cholesterol level can cause this drastic and significant effect. So again, can we change that genetic? Not today. At this time, genetic makeup cannot be changed. So that is a non-modifiable factor. How about the modifiable factors? How about the factors that can lead to, that can increase, that can aggravate atherosclerosis, but we can change them? So cholesterol, keeping it low is important. High cholesterol is a risk factor. Smoking is a huge risk factor. Hypertension, especially uncontrolled hypertension. 60% of uncontrolled hypertensive patients are going to have atherosclerosis and its effects, ischemic heart diseases, myocardial infarction. This is how important it is to control the hypertension. I have some data over here, we'll talk about it. Hypertensive are 60% more prone to atherosclerosis compared to normotensives as well. Diabetes mellitus goes without saying. One factor, one way that diabetes causes damage to the blood vessels is it causes the glycosylation. It pushes the glucose onto the cells and in their membranes, and it causes damage. So hypertension, diabetes mellitus, these are controllable factors. Hypertension can be controlled and should be controlled. Diabetes mellitus should be controlled. And then similarly, homocysteine or increased homocysteine levels are also suspected to be a problem, not fully known. But this is true that when the homocysteine levels are higher, there is increased propensity for atherosclerosis. Now, there are some factors that are not modifiable and that are not actually that are modifiable but are not conclusively agreed upon that they cause or aggravate atherosclerosis. What are those factors? Obesity. Many articles, many researches, they keep claiming that obesity is a reason for atherosclerosis. Not known. Maybe hypercholesterol levels or increased cholesterol levels, which may be contributing to obesity and to atherosclerosis may happen. But obesity by itself is not a cause of atherosclerosis. Similarly, it is also claimed that increased stress causes increased atherosclerosis. There is no such connection that has been found. Physical activity, it is said that, hey, you guys have to have physical activity and otherwise there will be atherosclerosis. That's not true, but physical activity becomes important when we come to the people who have higher cholesterol or people who have hypertension or people who have diabetes mellitus. Such patients, if they are physically active, then their benefits will also help reduce the atherosclerosis. Estrogen. So it was supposed that maybe the women who do not develop atherosclerosis before the menopause, the reason may have been, the claims were that this was because of estrogen. It turns out that if you administer estrogen after the menopause, that actually causes a woman to have a higher risk of atherosclerosis. So estrogen is probably not the reason. So these are the factors. How do you keep the factors in mind? Factors that are conclusively a risk factor for the atherosclerosis and factors that are not conclusive but are thought. Second, in the conclusively contributing factors, there are factors that are not modifiable, you can't do anything, they are immutable, and then factors that are modifiable. And of course, you work with the modifiable. The primary way to handle this disease is by controlling the modifiable factors, and second way is also to be controlling the modifiable factors but by using drugs. Okay, so now let's see here some more stats here. Men between the age of 40 to 60. Men between the age of 40 to 60 have 5 times increased risk of developing atherosclerosis or accelerating it. That means increased factor for ischemic heart disease as well. Gender, of course, males are more than female. Hypertension, about 60% of hypertensive patients have a greater probability of developing atherosclerosis compared to normotensive. And uncontrolled hypertensive, about 50%, I said 60% before, 50% of the uncontrolled hypertensives will die of ischemic heart diseases, which are a contribution of atherosclerosis.